feeling really bad.
Do you have an appointment?
No, but I need to see someone now.
Hi, what symptoms are you experiencing?
I feel really achy, and I've had a really high fever, and sometimes I have trouble breathing.
Well, this doesn't sound like the cold, but because you have a fever and are experiencing muscle aches, I suspect it's the flu. Have you gotten your shot yet? And how long have you had these symptoms?
Well, I got the shot about a week ago, but I've been feeling really bad for a couple days.
Well, it's probably the flu, but I'm going to run some tests to make sure. This test will collect some samples from your nasal passage, and we'll get these tests right back in so we can get you feeling better. Well, your tests will come back positive for the flu, but I'm a little worried since your symptoms have worsened in such a short time. Have you been around anyone with the flu?
No?
Have you been around a lot on a poultry farm?
Yeah, I've been in Asia for the past semester. My host family lived on a poultry farm. They were so nice.
When did you get back?
About 2 weeks ago, but I've been staying in the dorms ever since.
I'm going to run one more test, a polymerase chain reaction test. It'll take about a few hours to come back. I suspect that this is no normal flu because the symptoms are worsening at an extremely fast rate. I think it could be avian flu, but I don't want anyone to panic. We don't really have the blood test back. I think this might be a case of avian influenza because she recently got back from Asia where it is usually found. Watch the patient and her friend. We will need to place them into a quarantine room just as a precaution so the virus does not spread. The test results should be back soon. Call the CDC. It's avian flu. Contact the family and college.
Let's get this patient on some antibiotics.
No, the patient has the flu, which is a virus. Antibiotics don't work on viruses.
True, but we're going to give her them anyway because it'll lessen her chances of getting a secondary bacterial infection.
Hold on. So those antibiotics or whatever won't kill the flu?
No, but the flu kills the cilia cells that line the upper respiratory tract, and the cilia's function is to trap the bacteria before it enters the lungs. Once flu kills the cilia cells, the bacteria can slip down into deep lung and cause infection.
So the antibiotics are for the possibility of a secondary infection.
Okay, so then how do we get the bacteria that won't die?
Well, doctors prescribe antibiotics to patients, but for the infection to be completely killed, the entire round of antibiotics has to be taken. People usually stop taking them when they start to feel better. The weaker strains are killed, but the stronger strains not killed by the antibiotics live on, and that's how antibiotic-resistant bacteria are generated.
Sweet. Alright, so I know you tried to explain it to me, but is there any way you could explain them, like, antibiotics won't work on the virus?
Well, because a virus is a parasite that uses the host cell machinery to replicate. It has a protein capsid and contains nucleic acid inside, either DNA or RNA. A bacteria is a living organism, so antibiotics work on killing bacteria, but a virus requires a host cell to carry out functions. Since a virus is not alive, antibiotics won't work on it.
Alright, so what makes that flu virus different from other flu viruses, and how does it, whatever, change or mutate or whatever you said?
Well, the flu virus has 8 genes of RNA. RNA tend to mutate more than DNA viruses because its polymerase makes more mistakes and adds the wrong nucleotide. There are 2 kinds of mutations, antigenic drift and antigenic shift. Antigenic shift causes major changes.
Alright, well that makes sense, but what is this H something N something?
5N1.
Yeah, what's that?
It's the name of a particular flu strain. H and N stand for hemagglutinin and neuraminidase, which are glycoproteins in the flu virus membrane. They affect how the virus will infect, and there are many different ones with their particular properties, so we have to distinguish them by the numbers. H5N1 is the avian flu virus.
Oh.
Well, we better go check on the patient.
Yeah, let's do that.
I know all this information seems too much to handle for your daughter, but there are antiviral drugs that we can try to fight the avian flu. We can try the ones approved for regular influenza and the ones approved for avian influenza to see if the drugs will effectively fight the virus. Antiviral drugs are a rather new treatment option, and there are many factors you need to consider when deciding the treatment option. If I were to give you an antiviral drug, it would be Tamiflu.
I just want something to help my daughter.
Antiviral drugs are a form of treatment in which drugs attack the flu in a certain point in the replication process and doesn't allow for further replication. Tamiflu is a neuraminidase inhibitor. This means that it does not allow the virus to attach to the cell. Neuraminidase is a protein found on the outside of the protein capsid that allows the virus to recognize the cell. Tamiflu prevents this from happening.
Wait, my daughter's already in serious condition. Are these going to be okay?
Yes, they are made specifically for the virus, so they are safe. However, there may be side effects to taking these drugs.
Like what?
Nervousness, anxiety, difficulty concentrating, lightheadedness, nausea, vomiting are all some of the possible side effects. Nausea and vomiting are most common, but they may not happen if Tamiflu is taken with food.
Aside from the side effects, do you think these drugs are okay for my daughter to take?
Yes, even though there are side effects, the antiviral drug can really help combat the symptoms of influenza.
Side effects or not, I think it would be a good idea for Amber to take these antiviral drugs.
That's because in recent years, scientists have developed these medications. Tamiflu, the drug prescribed to your daughter, comes from shikimic acid in a flower found in Southwest Asia. Antiviral drugs are well developed because in recent years, a lot of research has gone into this form of treatment.
What?
Make sure she finishes it. No matter how well she feels after the first couple of doses, make sure she finishes the entire prescription.
How come?
The viruses can build up resistance against antiviral drugs, just like resistance against antibiotics. If the virus is not completely destroyed, this is the reason the resistance is a problem. These very beneficial drugs can become obsolete.
Oh, I'll be sure to get that prescription of Tamiflu right away. Thanks.
Oh, my head.
What's wrong?
I don't know. My head hurts, my body aches. I don't feel like doing anything.
Do you have the flu? Did you get the shot this year?
I never get the shot. I've heard such bad things about it.
Oh, well, I get it every year, and it really helps.
Well, what do? I'm already sick.
I would call your doctor. Supposedly these antiviral drugs really help. Last year my sister got the flu because she didn't get the shot, and my mom called and got these antiviral drugs, and they worked really well.
Well, I'll do it right now then.
Okay.
Hi, doctor. I think I have the flu, and my friend told me about antiviral drugs, and I was wondering if they could help with my symptoms.
Yes, antiviral drugs can help. Tamiflu is one of the ones we use to treat them, and how Tamiflu works is it blocks the influenza virus from replicating so it can't infect other cells, and it is approved to treat both type A and B influenza.
Well, how would I get Tamiflu if I wanted to get some?
Well, you would make a doctor's appointment, and your doctor would be able to explain more about the drugs and exactly how they should be administered and who can take them.
Thank you. I'll make an appointment right now.
Okay.
Tamiflu should be administered within 2 days of symptoms presenting. Tamiflu has been shown to prevent the patient from getting influenza for 42 days. Tamiflu is administered as a capsule or powder orally. Tamiflu will not treat flu-like symptoms caused by other viruses. If you do not have influenza, other treatment should be pursued. All patients are recommended to receive the flu vaccine every year, and taking Tamiflu should not discourage this decision. If you are under the age of 1, Tamiflu should not be administered. If you are taking any other medication, have impaired renal function, or are pregnant, notify the doctor at once. Some side effects include nausea, vomiting, diarrhea, stomach pain, and dizziness. If any of these symptoms present, please notify your doctor at once and discontinue use of Tamiflu.